Hello, my name is Maeve Gleason. The date is March 27th, 2025, and this is my video on diabetes type 1. So, diabetes type 1 is when a person's pancreas no longer produces or produces very little insulin. So, insulin treatment is needed for a lifetime. It can develop at any age, but most often it occurs in children, teens, and young adults. In most cases, diabetes 1 is caused by the body's immune system attacking and destroying the part of the pancreas that produces the insulin. So it's actually an autoimmune disease. The difference between diabetes type 1 and diabetes type 2. So diabetes type 1 is when the pancreas is not producing insulin or is producing very little. In contrast, in diabetes type 2, the pancreas is producing insulin, but the body is resistant to the action of the insulin, so it's not being used properly. How this impacts the system and creates an endocrine imbalance. So typically the body produces glucose from food and also gains glucose from food. The liver releases glucose when you're not eating as well. So the pancreas typically would produce the hormone insulin. And this hormone insulin allows the glucose from the bloodstream to enter the body's cells where it can be stored and used for energy. So some of that is immediate and some of it is stored for the future. And this energy fuels many bodily functions. In diabetes type 1, the pancreas is not producing this insulin, so this results in a buildup of glucose in the blood because the insulin is not able to help the glucose go into the cells. Diagnosis and screening. Move that out of the way. So there are a couple different blood tests. The first is an FBG, fasting blood glucose test. So in this test, blood is drawn after an overnight fast for at least 8 hours to test the glucose levels in the blood. The next test is an OGTT, oral glucose tolerance test. This test is done after fasting overnight for at least 8 hours. Blood is drawn and the glucose levels are monitored. Then the patient is asked to drink 8 ounces of a sugar solution, and blood glucose levels are measured 2 hours after. This test is more precise, but it's less convenient than the FBG. Finally, the A1C, hemoglobin A1C test, shows the average blood glucose levels over the past 3 months. So you can eat or drink normally before that blood test. Symptoms of diabetes type 1 include polydipsia, increased thirst, polyuria, increased urination, hyperphagia, which is constant hunger, weight loss, blurred vision, and constantly feeling tired or malaise. There are some serious side effects if the blood glucose levels are too high for too long, which can lead to some serious health complications. So these include blindness, kidney disease and failure, nerve damage, heart attacks, and stroke. So it's very important that diabetes is the blood glucose levels are kept in check. Treatment. People with type 1 diabetes must have daily injections of insulin to keep the normal level of the glucose in the blood and maintain homeostasis. Blood glucose is kept under best control with 3 or more injections per day using a long or short-acting insulin. And insulin can also be delivered throughout the day with an insulin pump. Important factors to include to manage diabetes are a healthy diet, exercise, and regular monitoring of the blood glucose levels. All right, to conclude, diabetes 1 occurs when the pancreas, an endocrine gland behind the stomach, is not producing enough of the hormone insulin or not producing any. And insulin is important because it helps carry sugar from the bloodstream into the cells, and this maintains homeostasis of blood sugar levels. All right, my source is down there. Thank you so much.